Hello and welcome to today's episode of Public Health Spotlights. I'm joined by Dr. Sandra Husbands, Director of Public Health at the London Borough of Hackney in the City of London. Welcome, Sandra.
Thank you, Maisie.
No worries. Can you just give us a bit of an introduction into yourself and your career in public health?
Yeah, so I've been a Director of Public Health here in Hackney in the City of London for the past, actually it's nearly 5.5 years, and I was a Director of Public Health in Wales before that. I started my public health career in 2003 when I joined the training programme in Kent, Surrey, Sussex and London, and did my training in Sussex and in London, and then worked in various locations within London mostly until about not long after the public health system changed in England and we moved into local authorities. And I stayed in local authority for about 18 months and then went to Public Health England. And then from there, I did a secondment in a local authority in Northamptonshire and kind of got more of a taste for working in local authority land. But also that was the point when I started sort of expanding my horizons. And so then my next job after that was the Director of Public Health job in Wales.
And what I guess really inspired you to pursue a career in public health? Why public health?
Yeah, well, I trained in medicine. And when I first went to medical school in the first few years, I was just very interested in how things work, and I wanted to do the sort of scientific exploration, and I went down that sort of scientific academic route, and did pure science, actually laboratory science, for several years, and then realised I actually wanted to do something that was more immediately applicable, and then went into clinical research. But it was while I was doing that, I was doing sort of both a clinical academic route and was a clinical lecturer, in fact. And it was during that job that it became really clear to me that what I really wanted to do was just make things work better.
Yeah.
As opposed to just find out how things work. And when I look back on it, actually, I was kind of interested in public health all through my medical training. And when I was a student, I got quite interested in tropical medicine. I did an intercalated degree, and I did some parasitology as part of that, and I did an elective in Brazil.
Yeah.
And while I was in Brazil, I was just so interested. This was the phase when I was really interested in the science of it, and I was thinking about, so why does this particular condition, which is an infectious condition called Chagas disease, which is caused by a trypanosome, and it's actually very common in South and Central America, and but it's a very interesting disease from an immunology point of view, which was my scientific interest. And why was it so difficult for the body to shed it? Why did your immune system not conquer it? That was what I was interested in. And I went to Brazil, and while I was on my elective, I collected tens of serum samples that I then carted all around Brazil in a rucksack under glycerine, which is the way to preserve them, to bring them back to England to analyse them. And I came back, we did all the analysis, but what really struck me when I was writing it up was that the common thing about all the people that I met who had chronic Chagas disease was that they were all poor, and they'd all grown up in housing that meant that they were exposed to the bugs that bite them and cause the infection. And I concluded, actually they just needed better housing. And so we could have, gone down the route of thinking about how do you develop vaccines. And there are people who've been doing that sort of work. But the reality is that if people just had better living conditions, they would be less likely to get infected.
Lies within the prevention.
And so when I look back on it, I was kind of really thinking about those sorts of things for a long time, but not really, it didn't all come together in public health until much later. And I happened to do a job at the Wellcome Trust, and I was working on the fellowship applications that were for, among other things, clinical epidemiology. And so I was reading all these grant applications, and they were just sounding like, this is really interesting. This is what I want to do. And I went and talked to my manager, and he said, I think you'd be really great at public health. And so then I applied for the training program.
You're a Director of Public Health. I guess as well, because the consultant in public health role and the Director of Public Health role is quite different. So what, I guess, sort of inspired you to want to make the jump from being a consultant director?
That's a good question, because I actually talk to new registrars from time to time, as part of their induction, and they ask me, why did you become director of public health? And the real answer is I needed a job, but the longer answer is, and at the time there weren't that many consultant jobs going, but there were director jobs going, but the longer answer is that I think there's probably something in all of us, although probably most people won't admit it, that in public health that we're slightly megalomaniacal. And so for instance, for me, the transition from clinical medicine into public health was about, to some degree, recognizing that I could make more of a difference working at a population level than seeing patients one at a time, because that would just take me a very long time to treat the whole population. But there's something about that. I could do more. I could have more influence. I could have more impact, and that's true when you're a public health consultant, actually, because there's lots of scope. It's a very broad specialty, and you have the opportunity to do some stuff that's very operational, have direct contact with the community, but also do really strategic things and have influence, and at board level, etc. So being a consultant actually gives you quite a lot of influence, but being a director gives you more, and also gets you into some rooms that you wouldn't get into as a consultant.
Nice. And as a director of public health, what are your primary responsibilities?
Well, I have a team, a department of it's 50 something. I always lose track of exactly how many people. I'll say 55 people. So I'm responsible for all of them. And then we have the whole breadth of the usual things that you might expect a local authority public health service to provide and deliver. So we have a health intelligence team. We have people who focus on or specialise in children's public health, public mental health, substance misuse, sexual health. We have a specific area around businesses. We have a program in the city called Business Healthy, which is a network for businesses to support each other in finding ways to improve employee health. They also are now branching into suicide prevention. We're also responsible for suicide prevention across City and Hackney, and have a particular focus on that in the city, which has a disproportionate amount of attempts because of the nature of it compared to the size of its population. That they're basically they're not people who live locally.
Okay.
And we have the other sorts of things you might expect, like around behavioural risk factors, stop smoking and tobacco control, healthy weight and healthy eating, physical activity, etc. We also work with our local NHS partners, and we work with other departments within both the City Corporation and London Borough of Hackney on planning, air quality, climate change, etc. So it's the whole range, and and then lots of little things that never get mentioned but are just as important.
And obviously you're director of public health for the City of London and London Borough of Hackney. So how do you sort of juggle the two? Does it bring any unique challenges or opportunities, you guys?
So I think working across two disparate organisations always brings challenges. I think it would be difficult if there were two NHS organisations, but they'd have a lot more in common than local authorities, which are very independent of each other, and they each have their own elected membership, and they set their own constitutions and have their own policy priorities. So that's a challenge there, because you're kind of the sort of split in your thinking. But then there's also the issue with time. So the city is very small geographically, and we have a small population. It's only about 9,000 residents, but you still have the full range of public health responsibilities regardless of how many people live there. And plus the city has these additional challenges, which is like the suicide prevention I just talked about, but also it's responsible for port health for the whole of the tidal Thames. We have a reach way beyond the boundaries of the square mile in terms of a lot of the other things that we do as a corporation, including running the city academies. So there's schools all over London that are run by the City Academies Trust. There's housing estates in other parts of London, and Epping Forest. So the city has wide responsibilities and therefore wide opportunity for using those assets and responsibilities for improving public health, as well as the usual things that a local authority does, like children's and adults, social care, and we have a big issue with rough sleeping in the city as well. So there's some specific issues around dealing with the people in the city and how we support them to stay healthy, improve their health, protect their health. The people who live in the city, whether they live on the street or they live in a home, and then the people who work in the city. And at its peak pre-COVID, we had something like 500,000 commuters into the city every day during the weekdays. And then the city is now in a transition phase from being very almost uniquely focused on, well, that's a bit harsh. Its primary focus as a corporation was on the businesses and supporting the businesses, and it's still a very important primary function of the city corporation. But it also is now thinking about how does it make the city more of a cultural destination as well as a business destination, and may think, well, what are the opportunities for us in supporting that work, but also using that as an opportunity for improving health and well-being for the residents and the people who come in to take advantage of those cultural offers. And then on the Hackney side, we've got something like 280,000 residents, and the city is very diverse too, but not quite as diverse as Hackney. And there are big inequalities within the city, but they are even starker within Hackney, or just as stark within Hackney. But there are more different communities that you have to understand and work with. So those are different challenges about the areas, but then there's the tension of working for two organisations and having to be in 4 places at once. Because of course, you've spoken to a number of directors of public health already. You probably know that we're always in 3 places at once anyway. That's when you work for one place. So when you're working for 2, you just have to multiply that.
And you're also, I know, part of the ADPH board. So that's also something that you've got going on as well. And I think you oversee the practice improvement for the ADPH. So what does that mean to you?
Well, I think practice improvement is it's really important, and it's a core part, or should be a core part of everything that we do. And I think one of the bits I missed out in my career journey is that I actually worked for the NHS Modernisation Agency, and there'll be some of your listeners who are old enough to remember it. And I got involved in that because of my desire to want to fix things. And for me, that's always about improvements. It's about not just saying there's a problem and fixing it, but saying that things can always be better and we can always do better, and that therefore we need to make conscious efforts to really understand the impact of our practice and the opportunities for improving it, and then make those improvements. And then doing practice improvement, both in terms of whether it's sector-led improvement or public health audit or the sort of traditional Institute of Health Improvement, quality improvement methodology, whichever way you do it, having a way to kind of both support each other to do that and kind of check against each other that we're really making improvements and not just going through the motions is also really is helpful but critical as well. And so for me, being the practice improvement lead on the board was something I was really interested in. When I first joined the board, actually, there was someone else doing that role, and there have been a number of changes in the board, but the opportunity came up because someone moved on, and I just wanted to go for that because it is a particular interest of mine.
And you've already sort of mentioned some of the challenges that you've been facing in the local area, sort of particularly around suicide prevention and other areas. Are there any recent initiatives that have had a real positive impact in your community that you could share?
Well, actually, we've had some good success with suicide prevention in the city. So although it has been a bit of a destination for some people, we've also actually through the work of a couple of particular members of my team, Andrew and Claire, have got a really robust suicide prevention plan with a really active suicide prevention working group, and it's ended up with us putting a number of initiatives in place. We also had really good support from members for that work, and from the City Bridge Trust, which is one of the city corporation. This would take too long to explain. But it's a very complicated organisation which includes a business element and a local authority element, and then some charitable elements, one of which is the City Bridges Trust, which is responsible for a number of bridges across the Thames. And so they've worked with us because one of the ways that people have been making attempts, obviously, is off bridges. And they've worked with us to put some support in place there, and with RNLI and with Samaritans, and so and obviously with the City of London Police and our mental health provider, East London Foundation Trust. So that's been a really collaborative effort, and it has brought the numbers down, and has been successful enough to draw attention of the wider corporation to that work, which has actually led to some funding from the wider corporation going into suicide prevention. So I would say that was a successful thing. Obviously, every suicide attempt and every completed suicide is a tragedy. And what we can't do is necessarily work with the people who come into the city before they come into the city. But what we can do is get them support at the time that they either make an attempt or they are in a place where someone thinks that they look like they need help. And one of the schemes associated with all of those things is called the Mental Health Street Triage program, which is where a trained mental health professional is actually available on call, and the police will just call them and they come out and meet people and have supported them. And it's reduced people being conveyed to A&E under section by the police. And we believe, although it's obviously that's much more difficult to prove, that it's actually reduced the numbers of suicides as well. So that's been a really successful project. Yeah.
Nice. And in sort of today's world, how we use sort of technology and data is becoming sort of increasingly more important. How do you use sort of technology and data here to sort of leverage some of the outcomes?
Well, we've got a pilot going on at the moment using AI, and actually it's actually about reducing the burden of work. But that's the
We're all
only real
trying
point
it
of
at the
AI,
moment.
isn't it? So like with public health teams, we use data to generate insights. But one of the things that everyone struggles with is, after you've done all the analyses and you've drawn all the charts, writing the report. And so we've got a pilot going on at the moment using AI to just write the report and see how that works. That's being led by my head of health intelligence, she's actually very forward thinking and likes to try and incorporate technology as much as possible. So we've been, just in terms of how we present the insights, we've been changing that a lot since she came into post, which I actually now think about, it was nearly 5 years ago. But she's changed us from primarily producing static, PDF reports into things that are much more interactive and where people can self-serve with the information rather than always having to come and ask us whatever question that they have. So that's both using the data and the technology together.
Yeah, it'll be interesting to see how AI pans out in public health, and looking forward to see what happens. And in terms of sort of engaging with the community, that's obviously really, really important. And I know a lot of boroughs sort of do it in different ways. How do you sort of think is best to engage with the community to address particular concerns?
I don't really think there's one way. I think the main thing is to think about community participation as a core part of what you do, and then understand the different types of participation and what's appropriate for what you're doing at the time. So, I mean, like a lot of places, we have a community champions program, and I'd always wanted to do that. We actually have done that before in other places. And when I came here, there wasn't one, and I wanted to establish one. And then in some senses, it was COVID that gave us the opportunity to do it, and to do it really quickly. And that's a way of engaging with different communities within our whole population in a more effective way, because those are people from the community who work with the community, who speak the language, who and when I say speak the language, it might even be English, but it's the vernacular. It's quite often when it's professionals talking to members of the public, there's a kind of language barrier. It becomes a kind of cross-cultural communication, doesn't it? Where we're talking one type of nonsense speak, and all they're hearing is, what it makes me think of is the teacher on Charlie Brown going, wow, wow, wow. Well, and in fact, we talk to the champions, we give them training, they get it, they understand it, and then they talk to people in their own words, and it's a much more effective way of communicating. But it's not just about working with the community. Is not just about communicating to them. It's also not just about hearing from them. It's actually about real participation in things that matter. So one of the things that we are in the process of developing is going to be a community-led needs assessment.
Engaging with the community is obviously so important, and I know lots of different authorities have very different ways of doing it. From your perspective, how is best to engage with the community and address their concerns?
Well, we're trying to make sure that working with communities is embedded in everything that we do, and it is actually one of our department priorities in terms of how we develop as a department. To move away from we're going to commission a service and provide it for you, to actually working with community to understand what the priorities are from their point of view and how best to support them to meet those priority issues, and whether you call it a need or whether you use a sort of deficit-based description or a strengths-based one. We have a community champions program, like a lot of other local authorities have, and that's a flexible and dynamic way of both working directly with people, as in the champions, but also working through them to make contact with, communicate with, hear from members of the wider community. And what's so great about that is that these champions are from all walks of life and all different communities within our overall population. And so it's just much easier for them to engage with other members of their communities. They speak their language. They don't talk in the sort of technical or management speak that we tend to. And so there's none of that sort of language barrier or cross-cultural communication that you might get. But also people, because they are known and they're local, they just have that sense of being a more trusted voice or a more trusted individual that you could tell something to. So that's one way that we are currently working with our communities, and that we want to continue to do and build on. But we're also thinking about how do we really build it into everything we do, including the health intelligence. So we've got a plan at the moment to do a community-led needs assessment, where we'll work with an anthropologist who'll help us to do that and to understand how you do that, but also use ethnographic techniques and get the community to tell us from their perspective, this is my community, this is what it's like for me, this is what it's like for our community, these are the priorities for us, these are the things that we're proud of, these are the issues for us, and suggest some of the ways that we could help address those issues. And we can put that together with the data that we have. So instead of the health needs assessment where we just look at the data, and then having looked at the data, we talk to some people, and we've already decided what we think the issues are based on the data. But instead of flipping it and saying, well, you tell us what the issues are and we'll tell you how the data are helping us to increase our understanding of the issues, and therefore jointly come up with some solutions.
That's a really good idea.
Thank you.
Start a trend.
Watch this space.
And sort of over your career, what would you say some of the most or the most valuable lesson you have learned has been?
Well, one of the most valuable lessons actually was about working with communities. I come from a medical background, and it was very, actually I quite honestly never particularly enjoyed being a paternalistic type of doctor, but the idea that somehow we all know best and that people should do what we tell them is one of those fantasies that we tell ourselves as public health professionals. But the reality is that we have our type of expertise, but everyone else has expertise about their own lives and what matters to them, but also what works for them. And that we really need to work with communities in a more effective way. And if you don't, if they don't have that ownership of whatever it is that you're trying to do, it's not going to be effective and it's not going to last. And so that was one of the key lessons for me that I learned. Actually, probably when I became a consultant, we touched on sort of community development and stuff like that when I was a registrar, but it was only when I became a consultant that I was working in an area where there was a new deals for communities and we had an effective actual community engagement as opposed to sort of consultation type department in the primary care trust that I was working in. And I just saw it in action and I learned from actually one of the best in community development, and it just really opened my eyes to what you could do, what you could achieve. That megalomaniac in me saying I want to do more, and how we could do that by working with and through communities.
That's the most important thing, really, isn't it? And obviously, sort of working with local authorities myself, I understand like the pressures and the financial challenges can be really, really tough. So how do you sort of stay motivated and inspired in your role when sometimes you sort of have these external challenges, which can ultimately be really, really tough?
Well, there are things like that in every job, really. I mean, to a greater or lesser degree, there's always something that makes it either boring or annoying or unpalatable. And as my friend Pat always says, well, that's why they call it work and they have to pay you to do it. But then the other side, of course, is that it's intellectually really stimulating. You get to work with people. You get to work with people who, like your colleagues, who are all very focused on doing good, being of service. If I just think about what are my core values, one of which is being useful or being of service, then doing public health really fits very well with that. And then to just know that I've contributed to something that's actually making people's lives better is what's really important for me. What gets me out of bed every day is that it's just interesting. It's really interesting and it's stimulating, and no 2 days are the same. And so if you're getting bored in this job, you're not doing it right.
Might not be the job for you. Oh, fair enough. And looking forward to the future, what do you think the future of public health looks like, particularly in the UK?
Yeah, well, that's a really interesting question. I think that we've got lots of opportunity over the next 5 years with the current government and their desire, although the current plan is only an NHS 10-year plan, but in it there's a lot of indication that they really want to do more that's about improving health, helping people to stay well, and the stuff that's really in our public health bag. And so it's not just about the shift to prevention is not just about preventing people going into hospital, or shouldn't be just about preventing people going into hospital. I think there's lots of scope to for us to really be working in a more collaborative way with the NHS and thinking about prevention as a core and fundamental thing that we're all responsible for, and that it's not just, well, we do this bit because that's the bit we get paid for, and we do this bit because that's the bit we get paid for. And I think there's an opportunity as well, because of the really difficult and constrained financial situation that local authorities are in, to be thinking in a more fundamental way about prevention. Because if we don't invest in keeping our population healthy and productive, all that does is increase the use of the other services. And so it's a longer term thing. It's obviously an invest to save. It's not, if you do it, this year you're suddenly going to halve your adult social care bill in the next year. That's clearly not going to happen. But at the same time, if we don't have a healthy, productive, happy population, it's going to increase all the other things: antisocial behaviour, substance use, crime, graffiti, litter, all these things that are going to cost the council money. And we should be thinking about how do we all get behind, the whole local authority get behind keeping the population as healthy as possible. So I think there are opportunities to do public health better, as in, the organised efforts of the whole of society as it's supposed to be in that WHO definition. In terms of what the system is going to look like, I don't know that there's much appetite for change on any side.
Yeah.
And I'm quite happy to work within whatever system we come up with, as long as we're not disabled by it. So as long as, in other words, they don't put constraints on and say that you can only do this or you can only do that, or that you must do this even if we don't think it's useful.
Yeah.
So I think that as long as we've got the scope to do evidence-informed and community-informed, effective public health practice, then I would happily work within whatever system that is. And I think that we could, as a whole system, continue to be effective if we don't have those constraints.
And people sort of like aspiring to enter public health, I mean, how can they sort of prepare for challenges or opportunities ahead?
So for people who are not doing public health at all yet, well, I think
Haven't entered the system.
no, I think there are some opportunities. I think that the apprenticeship program is a really good one. I don't know that there are that many places yet, but because some organisations haven't had the funding to fund an apprentice, but it's a really good opportunity to get the public health education, because you do a bachelor's in public health and then work in the public health department at the same time. So you're developing skills, and at the end of that, you have met all the requirements to become a registered practitioner. And we've had one apprentice complete the program so far, who's then come into a job in the team, and she's been brilliant, and it's been a very good experience for us. And we've got another apprentice starting shortly, and I'm hoping that we'll be able to expand some of those opportunities, including for the postgraduate level.
Great.
Yeah. So that's one way. I think the fact that public health departments are in local authorities actually in England gives people a lot of opportunity to sort of move sideways from another department, as long as your department, your head of service or your director of public health is open to the idea that you can bring people in and sort of grow your own. But at the same time, you have to remember that it is a technical specialty. So although everything that we achieve is because of the soft side and the leadership skills, etc., if you don't have the technical underpinning, you can't do it either. So people can move sideways, but they have to do that with the understanding that they're going to have to develop some of those technical skills in order to be able to deliver effectively. And so I think that thinking about, well, do I understand data? Maybe I can do something in my current role that's helping me to understand about how to do some basic analysis and present a chart in an effective way is a start. Obviously, it's not the same as epidemiology, but it's a start. And just some shadowing, some talking to people in local departments about public health is a good opportunity. And then, of course, there's always things that, like the RSPH training, which is for anybody, is very widely available, and that's a really good opportunity for people with no post-secondary education, who maybe don't even work in a local authority or whatever, to start to develop some public health skills and get in at the ground level and think about, well, then what's the next one and how do I work my way in. So I think there's lots of opportunity. The thing that I found until fairly recently, and maybe COVID was another one, was the thing that gave us a boost in that area as well, was that lots of people didn't even know what public health was until a few years ago. And it's apparently one of the most popular master's programs in universities now. But I think getting younger people, people at school still or in colleges where they've got a general education, but they don't know specifically what they want to do. Getting them to understand that that's an opportunity, that public health is an opportunity for them as well, is a thing that we need to do still.
No, that's really helpful. Thank you. And just to sort of close off, is there one piece of advice that you could give to somebody just sort of starting their journey as a consultant in public health?
So I would say, don't get too specialised. You may have a job that has a quite narrow portfolio, at the moment, but think about what the opportunities are for you to maybe work with colleagues or shadow other people and get a sense of the breadth of public health. Not because you necessarily need that to become a director of public health. It's perfectly possible to have been a CCDC and then become a director of public health, because that's actually much more about people management and strategy and not necessarily understanding all the specific details of every area. But what you want to do is try and keep your options open, because we don't know what's going to happen next. And, your department might downsize, or you might move to a different area for personal reasons. And you want to be as employable as possible. And so keeping as actively engaged in as much of public health as you can is a way to do that. And the other thing is to not get, what's the word? Don't get stuck thinking, well, this is it now, this is what I do for the rest of my life, and just keep your eyes open for opportunities. It's not disloyal to think, actually, I want to go and do something else somewhere else, because that's a really good opportunity for learning and growth.
Amazing. Well, thank you so much, Sandra. It's been absolutely lovely to speak with you. And I hope all our listeners who've been listening today have enjoyed it as much as I have.
Thank you so much, Maisie.
Thank you so much.